Hey everyone, today we are talking about sciatica. We're going to talk about what it is, causes, natural solutions, and I really hope you learn from this video. If you're watching for the first time, my name's Dr. Sandy. Been practicing chiropractic over 20 years. Sciatica is something obviously I see on the regular. And if you've been watching for some time, welcome back. Let's jump into it. So, sciatica, what is it exactly? It's one of the largest nerves in the human body, and it's responsible for giving information from the leg and moving the legs. So if we look over here, where does it start? So I'm looking at the human spine over here. This is a model. This violet color is the cervical, blue is thoracic, and this green area is the lumbar. Orange is the sacrum or the tailbone type area. So depending on the research you read, but generally it's agreed between L3 and L4 is the beginning of that sciatic nerve. It goes down L3, L4, L5, S1, S2, S3. So if any of these areas are affected, pinched, compressed, it could be a misalignment, disc herniation, disc bulging, those kind of things. That could put pressure on the sciatic nerve and result in that pain you may be having. And that pain usually will shoot into one leg. Very rare cases it can go into both, or it may switch, but usually when we meet a patient, it's the one side. And again, very debilitating. It's hard to walk. Quality of life absolutely gets affected. And again, it's all about that massive nerve that is that information highway getting compressed. And I always want to teach this principle to you. Symptoms are your alarm system. They're a blessing. The body's trying to tell you something's wrong and we need to act on it. Now, when is the best time to take care of the human spine and obviously human body? Is before the symptoms even show up. I think the next best time is when the symptoms are mild. So typically when I talk to a patient, they may say something like, yeah, I've had sciatica in the past. It would kind of come and go. I would rest for a few days, but it's never been this bad, Dr. Sandy. And what they're saying to me is they've had these symptoms. Maybe it's been months, maybe it's been for years, but now they're at the point like it's too much. And what I would say to you is however you want to manage something, take action. Again, before it shows up would be the best, but the next best time is that the minute something keeps showing up again and again, even if it's every few months and it's mild, get it checked, get it evaluated, get it taken care of, because your success rate is going to be higher. And one thing I love about chiropractic, we totally respect that. Yes, sometimes we need drugs, sometimes we need injections, and sometimes we even need a surgery, but those should be a last resort. We should always start conservative, natural, and kind of work up that ladder. And I believe if we are proactive with our health, surgeries would be a last resort, even the injections. It's all about self-responsibility, self-awareness, taking care of ourselves. And those are tools, again, that we can really do a lot to avoid if we are proactive with our body, if we are really taking care of ourselves, much like dentistry. If someone has, regular brushing, regularly seeing the dentist and they're preventative, the likelihood of a cavity or some type of procedure will be much less. If they're not managing their teeth, if they're getting pain, if they're getting symptoms and ignoring it, not keeping their appointments, eventually it could lead to a procedure or something that needs to be done because the teeth were not maintained. And I want you to have that same philosophy with the spine. The spine needs to be maintained, taken care of, and especially if you have symptoms, it needs to be managed. So as I said, the sciatic nerve is like L3, L4, lower spine from the tailbone, S1, S2, S3, and it goes into the leg. It gives you that motion, it gives you information, which is why if it's compressed, a lot of people will say it's a shooting pain, a stabbing pain. It may be hard to move the leg. And that area of the spine is so delicate because that lower part of the spine, you have nerves that are going to the colon, going to the bladder, going to reproductive organs. It's a very crucial part of the human body. Every part is, but every part of the spine is so powerful, it's so delicate, so they need to be taken care of. So what I'm saying is with that sciatic nerve, potentially you could have other pelvic issues which obviously need to be taken care of as well. Now, what are some of the causes of sciatica? I would say a big thing right now, because there's a lot of people who are sitting all day in front of their computer, and then when they get home, they're on a laptop gaming or they're on their phone a lot. Sitting extensively is squeezing the spine at the base, it's squeezing the disc, it's squeezing the cord. Then again, you will be in a higher risk of sciatica. So the simplest thing is obviously trying to get up on the regular every 30 minutes, every 40 minutes, every hour, taking breaks. Those are computer people. How about people who drive all day? If you're a truck driver, if you drive Uber, taxi driver, some kind of shipping job you have where you're just sitting all day, you are at a higher risk of sciatica, that shooting sensation, that numbness going into the leg. So you want to take breaks. And if you have a job where you drive a lot, when you take that break, get out, move, stretch, go for walks. The more you move the body, it's good for the spine, it's good for the nervous system. Movement is just good for the body. What else can cause it? Heavy lifting, a sports injury. So I kind of believe there's kind of two categories. One would be acute. So someone lifts something heavy, sports injury, something very sudden, and then they can get sciatica. I think the other category would be chronic, where you're just sitting a lot, where you're, just with the sitting, you're not moving as much, you have a sedentary lifestyle. That would be a higher risk. And that's something where you're like, wow, like I really don't lift or anything, but suddenly this pain just showed up, Dr. Sandy. That would be another category. So it's all about movement, being mindful, not doing the heavy lifting. And if you sit a lot, obviously taking those breaks. Another thing I will always say to you as well, stress is a huge factor on overall health. And yes, chronic stress can actually affect the low back and even the sciatic nerve. And you can say how? Well, if the system is overstimulated, if you're stressed, the muscles get tight, we see contraction. And if you already have weakness in the lower spine and you are tight and contracted, it can irritate those nerves in low back or even sciatica. So what are the options we have when someone is dealing with sciatica? So traditionally, it could be maybe taking some medicine, taking an over-the-counter, maybe using some creams and things like that. And again, that can lead to, if that's not effective, the injections, and if that doesn't work, like I said, the surgery. Again, all of these things I would recommend, the drugs, injections, and surgery. I feel these are stronger tools as a last resort. First things I would kind of look at, and it depends on the situation, but I'm going to give you some general principles, but you can, research for yourself or ask your healthcare practitioner if you're working with them. But generally speaking, with shooting pain, I usually recommend ice, and it depends on the person for how long, but ice, cold pack. Some people respond better with heat, but with a shooting pain, it's usually something cold. With a stiffness in the body, it's usually heat. Again, it depends on the person. And I'm usually conservative. I would say 5-10 minutes. And depending on the severity, and again, you would need a professional to talk you through this. It could be twice a day. It could be, twice an hour. It totally depends, but that's a general principle. Obviously, stretching as well. What I'm going to do is I'm going to include a link. I made another video on the best stretches if you do have sciatica, so I'll include that link as well. So those would be things. Obviously, if we talked about stress, relaxing, resting, prayer, meditation, and I want you to try those things. But if you're still suffering with sciatica or it keeps coming back again and again, and you really want to get to the root cause of it, I would ask you to at least consider getting evaluated chiropractically. Now, in our office, what we do is we do several measurements. We do a lot of measurements looking at the human body. We're looking for balance. We do bilateral weight scale. The best part of the testing we do is we have a special computer called the Insight, and it does all these type of nerve-focused tests. And we are looking at the health of the spine. We're looking at the muscle tone. We're looking at how the nerve system is operating. And we can do these tests to say, okay, how is your spinal health? How is the neurological health? We can look at that and say, okay, what do we need to do to balance the spine? Is there a misalignment, impinging a nerve affecting this? And I can tell you, as a chiropractor, sciatica, after 20 years plus of practicing that, that's something we see on the regular. We've helped a lot of people. In fact, I had a patient, people will ask me sometimes, they first meet me and they're like, I'm just worried I may have to get surgery. And we've been blessed. We've helped a lot of people avoid those kind of things because they came in at the appropriate time. They followed our protocols and we avoided those more stronger procedures. Is there a time and place? Absolutely. I think someone, if they can't even leave their bed, if they're non-functional, in those cases, I think those things have to be evaluated. But I'm telling you, for a lot of people, if it's caught early enough, chiropractic is powerful, it's gentle, it's specific, it's safe, it really helps the body. It's a great way to work with the body and not only get you out of pain, but restore function, restore power, so you can live at the highest level possible. Because most people I meet, they want to be active, they want to at least go for a walk, they want to be healthy, they want to be independent. A lot of people are now obviously going to the gym. People are more aware of their health, but you have to have a healthy structure. You have to have a healthy foundation. You need to have a healthy spine to be able to enjoy yourself, to have the confidence to do those things. So to me, chiropractic is about health. Really, when I see people come to us and I see those transformations, I think it's about building confidence. When you feel good, when you feel strong, the confidence you have that's authentic, it's amazing. So we'd love to see if we could help. We'd love to maybe give you that second opinion. Maybe it's a third opinion, but we'd love to be here for you to see if we can help. If we can help, we'll let you know. If we can't, we'll let you know, but we're here for you. So if you have any questions whatsoever, 905-896-3393 with any questions. If you're curious about a spinal evaluation, spinal checkup, we're here to help. And again, just maybe some general questions, 905-896-3393. Visit our website, gopowerflow.com. And if you enjoyed the video, please like, share, subscribe. And if you're going through something, we're here for you. But you might listen to this video and go, wow, I know someone who could really benefit Dr. Sandy. Share the video, share it with them, let them know that there's options out there. There's natural options if they take the proper action appropriately. If this person waits too long, obviously it's too late. But if they can get in soon enough, we can really make a difference, because we've seen it so many times and we've helped so many people. So God bless you. Make time for your health. Focus on your health. Your health is everything. Your life will be better. Your family life, your career, everything gets better when you're healthy. Make time for it, and God bless you.